Tracy has some excess skin on her upper eyelids, which has bothered her, and which she'd like really something done about. Now, there are two main things which contribute to excess skin on the upper eyelids as we age. One is that the brow falls down, and if Tracy just looks straight ahead, you can see that as the brow falls down, more heaviness and more skin appears on the upper eyelid. And the other is we actually do get frank excess of skin on that upper eyelid. Now, there are two ways of addressing this issue, and Tracy sort of has a combination of both. If we were to lift her eyebrows up, we can see that the skin comes off the upper eyelid, and certainly you can see more of it. But the other option is actually to physically take away some of the skin. I'll just gently take some of the skin here between these forceps. We can just see that if Tracy opens her eye now, we take some of that skin out, we'll certainly get to see more of her upper eyelid.
There's such a difference, Dr. Paul, with the two eyes, just by you lifting that up.
Yeah, there is quite a difference. Now, and that certainly helps with the appearance, the opening of the eyes, the usefulness of the eyes. With putting makeup on, it doesn't tend to spread. And that's what many women are concerned about, that they just can't put their makeup on anymore. One thing I always tell patients, they always still will have a fold of skin there, and it's very natural to have a fold of skin. So we don't want to take every single little bit of skin out, and there's definitely an amount that we need to leave there for just to look very normal. But we just want to naturally take out some of the excess.
What is the downtime?
Well, I usually tell patients about a week. It's really variable. It just depends on the amount of bruising or swelling that they get. Some people are actually fine within sort of 48 hours. Some people, if they get some bruising around their eyes, the bruising and swelling will take sort of a week, maybe even 10 days to go away. Yeah.
So when Tracy came to see you 2 weeks ago, you gave her the pros and cons of having such surgery?
Correct.
The benefits and...
So we talked about we talked about the risks for sure. We talked about the procedure in detail and how it would go, the recovery and sort of the variations in the recovery. We talked about how the brow also affects this, and so there are multiple components in the way that she's looking.
Dr. Paul, something that you and I talk about in the book is something about allowing the patients to have knowledge of what they're having done and really making up their own mind. Do you feel that having that consultation beforehand of doing such a procedure, even though this is quite minor, it's still important to be armed with the facts?
Oh, absolutely. There are a variety of options of how to manage each problem. It's still an operative procedure, so there are risks involved. But yes, it's very important to be armed with the facts. It's very important to be armed with a variety of options, because there are a variety of options for addressing all of these issues, and really the patient should feel comfortable with the decision that they've made.